Okay, guys, today I will talk about my EHR Access database file with 5 clinical decision support interventions that I implemented. So, just to give you all a little idea of what decided to choose for my implementations, the first one I decided to do was alert for the need for a PSA test if a patient is a male and over 50. Alert for the need for a colonoscopy if a patient is over 50. Alert for the need for a pap smear if a patient is female and over 50. Alert for the need for a mammogram if the patient is a female and over 50. And alert for if the patient is a smoker. So um, I felt that these um, interventions were very important to a system because sometimes a nurse and a doctor or other healthcare providers like a CNA or patient tech, sometimes they may be too busy to maybe remember exactly what to do if a patient is maybe over 50 and a male and needs a PSA test and they haven't had one already. So I feel like it's important that the system help them and to remind them of small things like this to make sure that the patient is being taken care of properly. So I felt like these were a few of the most important tests that need to be done regularly or annually. I felt like they were tests that really needed to be reminded at all times, just in case they may forget. And also, smoking is another important alert because sometimes a patient may need pamphlets or programs or classes to attend to maybe stop smoking or need some sort of motivation. So it's always important to ask the patient if they are um, a smoker so that you all can start those implementations right away to protect them from any lung cancer or anything like that. And we all know that mammograms are super important because um, cancer can happen as early as a child breast cancer can. So it's important to make sure that they have one over 50, but especially if they have a history of it, that's another important thing to take note of. And pap smear is also very important because that can um, allow the patient, allow the doctor or nurse to inform the patient to be on the lookout for any cervical cancer or anything like that at an early age. And the first two I mentioned were the PSA test and the colonoscopy test, and those are super important because as people age, some people rather not get those sort of tests done, but they're very important because they could lead to something very serious. So you want to prevent it before it starts happening. But as you can see, I have um, a patient table, and in my patient table, I have all of my patients listed, and it's basically like their information, unique identifiers that distinguish them, like their social security number, and then other information like their address, city, and all that stuff. And so next you have the patient education table, and on this table are different disease that I list, and I have a prescription table, and the prescription tables refers back to the patient ID table, so they sort of link together according to each patient to see what drug that they take, and what date the prescription date is, the quantity, and other important stuff to keep tally of, especially in need of an emergency if you need to see what the patient is taking, and also like the visit date. So it's very important to know when the patient was last visit because this can determine if something um, very important happened and you maybe not remember what their blood pressure was or their pulse, and you can easily refer back when their last visit date was or to refer back if they haven't been there, and that's another implementation that I could talk about later, is to see if they have came back to the doctor on their original visit date. And if not, you could allow the assistant to prompt you to give them a call and to discuss why they weren't able to make it to their appointment. But there's just a brief overview of my different tables that I have. So now I'm going to talk about my different interventions that I implemented. So this is just the message that keeps popping up, but if you just click OK, it'll take you to the patient information table that you should be on. So we'll use James as an example. So now James' birthday is April 18th, 1950. So we know based off this age, he is over 50. So, and also he is a male. So based off my implementations that I have, he could fall under a few. So we're going to just go here and click check alerts because all of his information has already been entered in. So um, whatever applies to him should automatically pop up in the alert box. So by him being over 50, he needs a PSA test and also he needs a colonoscopy test because he's over 50. And he also is a smoker. So you want to educate him on basically smoking and make sure he knows the consequences of smoking and make sure that he's aware of them. And if he would like to take the proper precautions to stop smoking or at least, decrease his chances of experiencing cancer later in life. Okay, and so if you just scroll down, we'll go down here to the bottom, we can go to a female patient and we have Emily here. So with Emily, she was born in 1980 and she's not a smoker. So we're just going to click check alerts and see what pops up. So she needs to pass smear, and Emily needs to pass smear because she is clearly over 21. And also, just to save time, you can easily back out of this year and put maybe the year of 2010, someone that you know is not 21 or older, and then you just click check alerts and it automatically disappears because the way the coding process was set up, it automatically clears out if the patient is not over the age of 21. It automatically clears out so it won't confuse the healthcare provider or whoever is using the system. And they won't have to just go back and press clear. It just automatically updates to the latest patient that there is. Let's see. So also, if you notice with Emily, the mammogram alert didn't pop up either because Emily is under the age of 50. But again, if I were to go here and just change her birth date to 1955, which you know they would be 63, when I click check alerts, it tells me that alerts me that she'll need a colonoscopy and also that she needs a mammogram because again she's over 50. And so also the same thing with the check, just for an example, we could easily check this box and then that alert will pop up that she needs to be educated on smoking. Not to say that she haven't already been educated, but it's a good thing to always check and see if they are educated about what's going on. And just a little more overview, I have the visit information here. So that's like the last time she came to the doctor. And the blood pressure and pulse and all that stuff is very great information to know because you want to know where your patient health stands at all times. It also tells the prescription that she's currently on right now and if she has any more refills and where she probably go gets it refilled because normally the physician talks over with with the patient about where they would like to get their prescriptions refilled at. And if we go to the prescription form, that just kind of simplifies the prescription down to just the prescription's information. And the visit form, just say on that date what happened and any visit notes. So this section is very important because it lets the next physician or nurse know exactly if there were any important things that you should be cautious for. And so far, this is all that I have for my database. And thank you.